All right, so people ask me about the dosing strategy. So let's talk about why we dose the way we do and what this is all about when we're giving a psychedelic substance, namely ketamine. So with ketamine, we usually start with what we call the Induction Series, which is a series of 6 sessions over the course of about 2 to 3 weeks. And the idea is that we progressively escalate the dose to get the desired effect. Now, what we're doing here is really, really different than other areas of medicine, right? Because when you take, like, let's say penicillin for strep throat, the idea there is you just take it, for 7 days, whatever the case may be. You're just trying to kill the bacteria that causes strep throat. So you're not much of a participant in the process other than just taking the medication. Now, with a psychedelic substance, like with ketamine, what we're trying to do is we're trying to get to that point where we have this transpersonal experience. You have this transformative experience at a certain dose. And the thing is, if I took you there on day 1, I'd scare the hell out of you, right? I mean, you wouldn't know what to do with it. So it has to be a progression, has to be a stepwise escalation, because that's the thing, is we're trying to get you used to it. We're trying to have you go through this process. So, the first session, we give you enough ketamine where you get a feel for it. You kind of know, you get the experience. But the problem is then, for most people who haven't had a psychedelic experience, and for those who haven't tried ketamine before, you don't even know what game you're playing, right? You kind of know there's a crowd, that you're in a stadium of some sort, but you don't know if you're playing soccer, you're playing football, you're just completely lost. Now, on the second session, the third session, you start to get a hang of where we're at, what we're trying to do, right? So that's where you're kind of, okay, I'm kind of getting there. And then by the third, fourth, fifth session, we can get to that point where we really take you to that place, take you through that looking glass, take you to that space. Because, like I've said in some of my other videos, what we're trying to accomplish is to treat the existential crisis that people who have had psychological trauma are experiencing. And if you question, well, who's had psychological trauma? Well, I guess that would kind of be almost everybody, right? So, I mean, I've said multiple times that life is a contact sport. But specifically, when you go through a psychologically traumatic event, I think it leaves you with 2 existential questions, right? Well, why did that happen? And then how do I move on from there? So when you start asking, like, well, what dose do I need to use? Like, what's the milligrams per kilogram and whatnot? Well, I don't know. I mean, we need to get to a dose that answers the existential questions, right? So that's what's kind of rock and roll about this, So we get to that point, we're trying to get you to that transpersonal experience. So again, to use an analogy, like if you want to, join a martial arts program or whatever, like, on day 1, you would never want to just go fight with a black belt or spar with a black belt. You kind of get your butt kicked, right? So the idea is you go in as a white belt, you learn how to punch, you learn how not to put your thumb in the middle of your fist, learn how to punch, all this kind of thing, and then you escalate, you get better and better, and you experience this, and that's where you can finally get into this space where we put you to this moment where your ego is disrupted, where all the parts of your mind that lie to you, that tell you you're not good enough, you're not not rich enough, not sexy enough, you can't do as many push-ups as the next person, whatever, that all disappears. And that's what we're trying to accomplish with the progressive escalation of doses in ketamine treatment.